So good morning, everybody. My name is Lavleen Sahota, and I completed my practicum with BC Healthy Communities, which is a province-wide nonprofit with a consulting arm, and they work with local governments, health authorities, and other organizations to promote healthy, thriving, and resilient communities. And it's a unique organization in that the fields of planning and public health work together to promote healthy communities for all. And these consist of healthy people who live in healthy societies within the context of healthy natural and built environments, such as healthy housing. And my project worked to promote healthy housing. And so that's defined as housing that is affordable, so costing less than 30% of one's household income. It's made up of diverse forms and tenure types. It's adequate in its physical quality and livability, suitable for all family sizes, ages, and abilities, and it's located in areas that are safe, free of environmental hazards, near transportation networks, green space, and community amenities to promote connectivity. And it should be noted that these principles of healthy housing are often informed by the field of planning, and so I was lucky enough to work with 2 community planners for my project. And one way to work towards healthy communities for all is to use the 5 pillars of the healthy communities approach, which is what we used in our project, and I'll talk about this a bit later. And so I was involved in a housing strategy for the regional district of Mount Waddington, which is located on the traditional territory of the Kwakwala-speaking peoples. So BC Healthy Communities was hired by the Mount Waddington Health Network, and we've already heard today and yesterday that health networks work to promote healthy communities by influencing the social determinants of health. And the Mount Waddington Health Network consists of representation from local governments, community members, First Nations representatives, and public service organizations, nonprofits, and community organizations. And so right now they're prioritizing housing and homelessness in their strategic plan. And so what they really wanted from us was an action-oriented plan which would guide the regional district and the health network to work towards addressing the unique housing needs of the community. And so the regional district of Mount Waddington is located on the northern tip of Vancouver Island, consisting of communities such as Port Hardy, Port McNeill, and Alert Bay, to name a few. There's 30 First Nations communities in the region, and 30% of the population identifies as Aboriginal. In the past, resource industries such as mining, forestry, and fishing were quite prominent, but those industries over the years have declined, and with that has come a population decline, with currently about 11,000 people living in the region. Housing isn't very diverse in the region. It's mainly made up of single-family homes. There's also a very low rental vacancy with approximately less than 1% rental vacancy, and that's significant because a healthy rental vacancy is actually between 5 and 7%. There's also an increase in homelessness in the region with visible homelessness and also people couch surfing. So the health network recognizes that unsafe, affordable, unstable, unsuitable housing will result in stress, unhealthy coping mechanisms, crime, and ultimately negative population health outcomes, whereas healthy housing will result in a healthier community by creating a safer environment, healthier environment, increasing the health and well-being of communities. So this work is quite important. So I was involved in the first phase of the project, which was a scan of the housing needs and gaps in the region. And so for the first part, we did some research and analysis where we looked at background documents such as official community plans, the Mount Waddington Regional Plan, Stats Canada census data from 2016, First Nations local government agreements, and a housing needs assessment from 2013. We then came up with an initial key findings report, which we presented at the Mount Waddington Health Network Table of Partners meeting in Port McNeill. And the visit to the region also offered an opportunity for us to do an observational scan of housing and conduct some informal stakeholder interviews. And throughout the process, we used equity and proportionate universalism lenses. So what this meant is constantly asking who will benefit from these processes and policies and how, and who might not benefit and why. So for example, at the Table of Partners meeting, we asked who's not at the table. In addition, if you're looking at proportionate universalism, you support all people according to their level of need. So for our strategy, we weren't only focusing on homelessness, we ensured that interests across the housing spectrum from homelessness to market housing were included. That said, if you look at the graph on the left, it shows housing indicators in Mount Waddington compared to BC, and Mount Waddington is in the teal. And the last indicator there, affordability, actually shows that housing in the region is quite affordable compared to the rest of BC. But we also know that for 37% of the population, housing is unaffordable. So if we're to apply those equity and proportionate universalism lenses, we are going to highlight the need for affordable housing in the region. And it's interesting, when we actually presented this graph at our Table of Partners meeting, people said that the adequacy and suitability graphs there, that's not representative of rental housing or band housing. So that to us really represented how important it was to actually go to the region, talk to people, see what's actually happening with housing, because the stats are only telling part of the story. And so the visit to the region offered an opportunity to get a fuller picture of the context of housing in the region, and also helped us build momentum with our project because people were excited to hear about the project and really wanted to be involved. And we also had a chance to identify who and what some of the assets of the region are. And so very briefly, I won't go through all of these, but there were missing health and equity lenses in a lot of the documents we were reviewing. There wasn't a whole lot of information about homelessness. There was no homeless count for the region, so we were missing all that information. And again, when we visited the region and spoke to particular stakeholders, we were able to gather that information. There's also development challenges within the region that are, specific to rural areas. It's expensive to construct housing, so you can't just say, oh, you don't have housing, let's just build a bunch of new housing. It's difficult because construction costs are high due to having to ship materials, and it's also hard to employ skilled labor because there's a shortage of skilled labor in the region, and it's also really difficult to attract developers to a region such as Mount Waddington. And so what are some of the implications for public health? So going back to that healthy communities approach, there's 5 pillars to the approach, and I learned that planners actually do these things quite well. So community engagement. You need to engage your community early, and you need to engage them where they're at. So again, we tried to send emails and phone people when we were working remotely from Victoria on this project, but people weren't getting back to us. I don't blame them. They didn't know about the project, but as soon as we were in the region, we were able to really get a better sense of what was going on, and people were connecting with us and really excited to work on the project. And again, we were able to get a fuller picture of the needs and assets of the region. Multi-sectoral partnership is required when you're trying to work towards solving complex public health issues such as housing. So again, planning, public health, local governments, First Nations, all working together to work towards these complex issues. Political commitment is also required to work towards healthy public policy. So in this example, we actually had the political commitment, but oftentimes you don't. And that's where you need to really frame your messages so that you're speaking to the values of those elected or those in policymaking positions. And asset-based community development. So that's really using a strengths-based approach, identifying your assets, and then ultimately working towards building capacity in the community. So again, really important to be at the table, build relationships. So, public health needs to talk to planners, talk to local governments, and really, be there at the table so that you're able to frame your messages. The health and equity lenses are what we bring to the table in public health, and we need to be able to sell those messages to other stakeholders. Context is very important. Again, we couldn't just bring a bunch of urban housing strategies to this region. There's no one-size-fits-all approach to issues such as housing, and so really take the time to learn what the context is. And that requires using multiple sources of information. Again, get out of the office. We weren't learning a whole lot when we were looking at stats in Victoria. And so big shout out to the Mount Waddington Health Network, the Regional District of Mount Waddington, and everybody at BC Healthy Communities for an amazing practicum experience, especially my Practicum supervisors, Victoria Barr and Shannon Clark, and healthy community planners, Sarah Ravlich and Sandy Mackey. Thank you.
Hello. Hi. Great presentation. I'm just wondering if you gathered any information on how Airbnb or short-term rentals impact housing when you were doing your project?
That's a great question, Jenna. So it's funny, we were actually up in Mount Waddington last week presenting our stakeholder interview information, and that's something that came up. We actually didn't, in the scan process, look at Airbnbs, but there's also other short-term rentals or housing that's not available, such as waterfront cottages or vacation homes that people who aren't living in the region are buying. And so we're not quite sure yet how that's affecting the housing, but it's an area that we'll definitely consider moving forward. And it's an interesting point because another issue with Mount Waddington is that it needs an overarching economic development plan, and I think tourism is something that they're moving towards, so Airbnbs would again be coming up a bit more, so definitely something to consider, but as of yet we haven't done that research.
No more questions? Okay, thank you very much.